a very Merry Christmas.
Call in Lees-Galloway.
Thank you very much, Mr Speaker. The opening paragraph of the Health Select Committee's inquiry into improving child health outcomes and preventing child abuse with a focus from preconception until 3 years of age states, the major recommendations of this inquiry ask the government to put more focus on and investment into the preconception period of 3 to 3 years of age, and take a proactive health promotion, disease prevention approach based on scientific evidence to improving children's outcomes and diminishing child abuse. And so that is the central theme of this report, a report which has received support from across the House. And in the spirit of bipartisanship that is on display today, sir, I want to gently point out that to achieve the outcomes stated, or to achieve the aims stated in that first paragraph, will require a significant change in policy from that that has been currently implemented by the national-led government. And I want to look at the current health targets and relate them to the aims of a proactive health promotion, disease prevention approach to health. First of all, we have shorter stays in emergency departments. That is a target focused on what you do after a child becomes ill or they are injured. It is not focused on preventing illness or injury. Improved access to elective surgery actually doesn't affect children all that much at all, but again is what you do after someone becomes unwell. Shorter waits for cancer treatment. Again, not about preventing cancer from happening, but how we respond, how our health system is reactive to illness. There's increased immunisation, and this is the one place where the government can pat itself on the back, and I notice this is the one thing that the National Party members hang on to for dear life, because it is the one place that they can be proud of. But I would point out that what's interesting is that in the fight against rheumatic fever, one of the big objectives for the government is to find a vaccine for rheumatic fever. That sounds to me, sir, like they are trying to find a vaccine for poverty, because what we should be doing is preventing rheumatic fever from ensuring that our children grow up in warm, dry homes and have good nutrition. The target for better help for smokers to quit, again, that's what you do after someone becomes a smoker. You then try and help them quit. And more heart and diabetes checks isn't about preventing cardiovascular disease or preventing diabetes, but measuring it, finding it, and then trying to do something about it. These targets reflect a health system that is reactive, not proactive. And sir, it is fantastic that this evidence-based report that has the support from all parties in Parliament promotes a proactive disease prevention approach to our health system, one which is quite different from what we have at the moment. Chapter 4 of this report refers to the social and economic determinants of health and well-being. Recommendation 18 says, we recommend to the government that it continue to actively consider the recommendations and solutions to child poverty in New Zealand, evidence for action, and at least establish an overall action plan for reducing child poverty, or a better public service target for child poverty. And as has been well debated in the House over the last week and the preceding weeks, there is no target for this government to reduce child poverty. There is no target for reducing child poverty, and I'm pleased that this report clearly recommends that we need a target for child poverty, sir. I finally want to refer to Chapter 5, which is about improving nutrition and reducing obesity and related non-communicable diseases. Sir, it says again that a health promotion approach directed through communities is what we need. We need a primary disease prevention approach. And it is sad, sir, that programs like Healthy Eating, Healthy Action were cut by this government, because those are precisely the programs that this report recommends. So this is a great report. It will be a report that future governments refer to, and I look forward to it being fully implemented, whatever government is in place in the future.
I call Simon O'Connor.
Yeah, indeed, it will be a national government, Minister, and it's been from a national